First of all, could you just introduce yourself and tell us a little bit about your journey to getting an MS diagnosis?
So my name's Regan, and when I was little, there was little signs of it, but we didn't really pick up on it as anything other than I had lots of UTIs or my walking downstairs, things like that. It was like a shuffle. When I went to get diagnosed initially, I went with assuming I had like a trapped nerve in my neck or like I damaged it during dancing. But when I went, it was a junior doctor, and he noticed that I had one-sided weakness. And then following that, I actually collapsed. So I ended up with Lemtrada. So I'd gone for a scan in the morning. I went back, and I remember we were just waiting in the ward, and I went into this room, and there was a nurse with the doctor. And in my head, I was thinking, I've seen this in TV. This can't be like a good sign. So that's when they said, we have suspicions that it's MS. And I had no idea what it was. I assumed I'd get like antibiotics and I'd be good to go. So they were like, yeah, we think, you've got MS and we need to do a further scan with contrast. So I was like, that's fine. We waited, I think it was like 3 o'clock in the afternoon, and I got my second scan at that point. And then they had to do a lumbar puncture. And I had no idea what one of those was. And I hate needles. And I ended up fainting while they were doing it. So they had to go again. And there was just all these complications with it. And I was like, oh, because at this point it was like 10 o'clock at night. I was knackered.
Yeah.
And I just wanted to go home. So I did get diagnosed that night, basically via the scans. And then it just got reconfirmed almost when the lumbar puncture results did come back.
What was it like sort of going through all of that when you were so young, and starting treatment when you were young as well?
I think because initially the treatment that I had was Capaxin, and that was like daily injections.
Mm-hmm.
It sort of came, it was just normal. Eventually I was just like, okay, yeah, I'll take this and I'll be fine. So I was quite naive. I did just think, oh yeah, this drug will be fine and I'll be absolutely okay with it. And I ended up having anaphylaxis with that drug.
Oh gosh.
And it wasn't working anyway. So I ended up coming off that, and that was quite hard to deal with because obviously, I was trying to go to school. I was trying to hide my MS a lot. I'd only told my friends at that point, and it was in school I ended up using a crutch, so people were noticing more and more that, oh, there's actually something wrong there. And to go on to Lemtrada, it was branded like this miracle drug for me. They told me how wonderful it was, and I was like, okay, yeah, that's fine, it's a one-off infusion at the time and it'll be great and it'll just fit into summer nicely. But I ended up, the way it landed was right before my exams.
Oh no.
So I'd had 2 weeks before my exams, I had Lemtrada. So I was trying to revise, plus, try taking all this information about this drug I was being given. And obviously you have to be really careful with your immune system at that point. So we had to arrange a private room for my exams, and it just made the whole thing added stress. You have this big treatment, you have these exams that you're told that's it, that's going to decide what you do when you leave school. And I was like, I can't focus on both these things at once, and it was a lot. But no, it was quite tough, and especially to find out the first year hadn't really worked as well as hoped, to then go on a second year again right before my exams, knowing the sort of situation was going to be as stressful as it was before. It was quite sort of disheartening at the time, because I was like, well, what's the point of doing it and adding all these things? But it did sort of hold back my MS as much as it could at the time, I guess. But now, looking back, I was like, oh, timing could have been so much better. Right before my 18th, I had exams and I had this treatment and I couldn't go out or do anything because my immune system. So no, it was weird. The priorities were very different, at the time of getting the treatment, but it was quite handy to have.
Yeah, it sounds like everything sort of happened at once. I can't imagine sort of having to focus on deciding to go on a really sort of powerful disease modifying drug and then also having to manage all your exams and things at school at the same time as well. So it's sounded like the timing was a bit crazy.
Yeah.
So what made you decide to go with Lemtrada in the first place? You mentioned that you tried Copaxone, but that I'm guessing that wasn't effective for your MS initially.
Yeah, so I think we'd sort of noticed that the drug Copaxone wasn't compatible at all. Like I was ending up like swelling, like in the brain. Like it caused me a lot more problems than it helped with. So we thought, we have to go for something that hits harder. But the issue was at my age at the time as well, they weren't happy for someone my like under 18 to go on these big drugs. So they had to fight for that. So I remember we had to like appeal to Aberdeen and like all these different places to be like, okay, can she get it? She needs it. And like they okayed it and everything was great. And I was like, oh, how amazing. Like I'm going to go on this drug. But it was quite difficult because they'd offered me other treatments at the same time. So it was like weighing things up at that point and going from like this Copaxone injection to this big IV drip, and like it was quite intimidating. But I ended up testing positive for like the JC virus. Yeah. So that cancelled out my other option. Yeah. So I was sort of just left with Lemtrada. Mm-hmm. And it was basically just like, you're going on this. It wasn't so much of a choice at the time. It was, right, this is what you're getting and this is what, it's going to work and you'll be fine. So it was quite interesting, that point of view, because like a lot of people get the choices and, it was quite lucky for me because I didn't have to worry about it. I was basically just told, which like growing up now and having to look at other drugs, it's so much handier, that process of just being given that drug and being told, right, that's what you're getting, go with it, we'll try it. So it was quite handy, but it was quite a quick decision as well once everything was okayed.
Yeah. Scary decision as well because it is a really powerful drug. So were there any tests that you had to go through before you were allowed to have Lemtrada? So did you have to have sort of like blood tests and any other scans and things?
So you have to get a TB test done. Mm-hmm. And I initially thought it was like you do get bloods done. You get a whole lot of bloods done just to test like baseline, because Lemtrada can affect like your thyroid function, your liver, things like that. So you do get a baseline bloods done, and you have to get a chest X-ray just to look for dormant TB, anything like that, and to make sure you don't have any respiratory issues because it can affect cause infections. But the TB test is just like this little bubble of fluid that you get put in under the skin, and if it goes flat, it basically shows that you don't have any signs of dormant TB. But mine was fine, and it was all done like in a day. You just went into the clinic, got it done, and that was it.
Mm-hmm. And can you talk through a little bit about how Lemtrada is actually given? Because I know you have sort of 2 treatment courses in 2 years. So could you just talk through that for me?
Yes. So your first year is 5 days of the treatment. So you're in pretty much for the day in the infusion suite, and you have like your pre-treatment. So I think it's something like antihistamines. I had anti-sickness added in because I just don't tolerate medications very well. So they threw an anti-sickness, antihistamines, and you get a steroid, just to make sure things go fine. So you get that for the 5 days, and they just monitor things. So it's quite a slow drip, because I think they found the first day I had mine, it went a bit too fast, the infusion almost. So I ended up like a migraine sickness. So the next day it got slowed down. So it took longer, but it was worth it side effects wise. And then the second year, it was 3 days, a 3-day course of it. So you get the steroids for the 3 days instead of the 5 days in the first year. And you get a whole load of like aftercare for each treatment. So you have antifungal, like antivirus sort of things, and just things really to boost your immune system. So you have to be really strict and like keep that up, because obviously the risk of infection is so high following something like Lemtrada.
Yeah, so there's a lot involved really. It's not just a case of having the medication itself. There's a lot of other elements to it as well. I was just going to ask if you could sort of talk through what a typical day when you went for your infusion was like how long were you there, sort of what was involved, was there a lot of sort of sitting around hooked up to the drip sort of thing? What was it actually like?
The infusion itself takes quite a while. You go like in the morning and you usually leave in like late afternoon. But sometimes they are faster or slower depending on how you react to the infusion. But when you first get there, you get all your pre-meds. So that's like steroids, antihistamines, and I think anti-sickness if you're needing it. And you'll usually get your cannula that will last you maybe 3 days at most. Especially if you've got like bad like veins, and like if they struggle usually to get blood or whatever, they'll give you the cannula over 3 days. So you're there and you can sort of move around like with your drip. Usually it's sort of okay to do that, you know, you're not really stuck in the chair unless obviously mobility wise you struggle, but you're sort of okay as long as you wear like easy clothing to get on and off, to like when you need to go to the bathroom and stuff, it's fine. But most of the time it's okay. Just take a book or like take something with you, because it can get quite boring when you're there for 8 hours. I think my first one I went down at 8:30 and I came back to the hospital ward at about 6. It's a lot at the time, and obviously you have to be careful as well who's coming to visit, because if someone's got the cold or you know anything like that, especially when you're maybe a couple of days into it, your immune system is obviously getting knocked, so you want to be from the get-go keeping yourself safe and just keeping responsible, I guess, at the same time.
And how have you found how have you been getting on with side effects? Did you notice any after you had the infusions?
I mean, there was the effects of the infusion itself, like the first few days, because it went a bit too fast. So there was like migraines and sickness and things like that, but they just slow things down, and it gets easier the more your body gets used to it, I guess. There wasn't many side effects for me personally. I was quite lucky that way. Obviously you're at higher risk of like colds and like mild sort of, as well as bigger infections, but it's trying to just keep on top of it, I guess. And you do get aftercare, so you get the whole like antiviral and things like that you have to keep up to date with for the next while, and it's really important that you take those, because obviously you don't want to go through that 5 days of Lemtrada to then, you know, get an infection that knocks everything. But it's, I can't really say side effects wise following. I did get a bit more achy joints, but I think that's just through, they say it's through when things build back up. It's like when your lymphocyte count goes back up and stuff, you can get a bit more achy and you a bit more like fatigue following the treatment, because obviously you're stressed, you're getting this treatment, and just the effect it has on your body is quite exhausting. But it doesn't take long, and out of all the treatments I've had, I think it was one of the best, like the best one side effects wise, so that's definitely positive of it.
And have you had to have sort of much monitoring since you had the treatment? Have you had to have sort of regular blood tests or scans or things?
So I had monthly blood tests every month for 4 years following my last like treatment round. So obviously the last day is 3 days, so following that date, the last day of that, you have to have monitoring for 4 years, which, I mean, it just becomes part of, it's just another appointment or whatever, so it's not too bad. But at first, when I had school to juggle with and everything else, it was a bit like trying to get an appointment that would suit daily life. But you get used to it, and it's worth it, because you're looking at thyroid function, liver function. So it is important to get it all done. It's just at the start it gets a bit, not annoying, but you think, oh, I've got this for 4 years.
Yeah. So overall, have you found Lemtrada quite a convenient treatment to be on? Has it fitted in well with sort of your school life, education and working life? How have you found it?
I mean, it was really convenient in the sense it's sort of condensed.
Yeah.
It's better than, in my opinion, it's better than having the daily injections or daily tablets and things like that. And obviously there's monthly treatments as well now that you can get infusions. But I would say, if you're sort of in a busy schedule in life and things like that, and say you're working the majority of the week, to just get that maybe 1 week off for the treatment and then maybe a following week to recover, and just pick yourself back up and then go back out, as well as being safe. It is really, like, it is great to have that option, and especially because it's a year apart, you don't really have to worry about it. You'll get your scan done like at the halfway point, and then you'll go again to have your second round. And especially with that being even shorter, so it is, I think it suits a lot of people to have it done. So yeah, I think it was quite a convenient treatment to have. It's just remembering that it isn't a one size fits all, I guess.
No. And has Lemtrada worked for you? Or are you having to look at sort of trying other disease modifying drugs now? When did you finish your last treatment course?
So my last treatment course was in 2017. That was when I had my 3-day.
Yeah.
So unfortunately it didn't work for me. The first year, I'd say it did give me that bit of a boost. And it did hold off quite a few things that were going on. So they'd said to me, maybe consider using your wheelchair a bit more at that point. And I found that it did hold off a lot of the physical symptoms of MS. My walking maintained for a good while, but unfortunately now I am looking to start a new treatment. I've had Tecfidera over the last year just with COVID, and now I'm looking to start Ocrevus. But it is just that thing that it doesn't always work for everybody, but the treatment itself, to get it in the way it's given, is so helpful. And it was a great opportunity to have with it.